So you or maybe someone you care about has been prescribed methimazole, and you've probably got some questions. Well, you've come to the right place. Today, we're going to break down exactly what this medication is, how it works for an overactive thyroid, and most importantly, what you need to know to use it safely. Let's dive right in. You know that feeling like your body's engine is just stuck in high gear and you can't find the brakes? Your heart is racing, you're anxious out of nowhere, maybe losing weight even though you're eating all the time, and you're just always hot. It's like you're running a marathon, but you're just sitting on the couch. For a lot of people, that's exactly what an overactive thyroid feels like. All right, so here's our game plan. We'll start with the problem itself, the overactive thyroid. Then we'll get into how methimazole actually works, when doctors use it, the risks you need to be aware of, and finally, your incredibly important role in making this treatment a success. Okay, first things first, let's really pin down the problem we're trying to solve. We're talking about an overactive thyroid, which has a medical name, hyperthyroidism. So, what is hyperthyroidism? Well, think of your thyroid as the thermostat for your body's metabolism. In this case, the thermostat is broken and stuck on high. It starts pumping out way too much of the thyroid hormones, T3 and T4, and that's what throws your whole system out of whack, creating that constant engine in overdrive feeling. So, if the engine is racing, how do we slow it down? This is where methimazole comes in. Let's talk about how it puts the brakes on that out-of-control hormone production. I love this analogy. Your thyroid is like a hormone factory. Now, methimazole doesn't go in and blow up the hormones that have already been made and are floating around in your body. Instead, it walks right onto the factory floor and tells the assembly line to just stop. It cuts off the production of new hormones. Let's get a little more specific. So, the raw material for these hormones is iodine. An enzyme called TPO, think of it as a specialized factory worker, is supposed to take that iodine and build the hormones. Methimazole comes in and basically tells that TPO worker to take a break. It blocks the enzyme so it can't do its job. And just like that, the assembly line grinds to a halt. Now, this is a really important point. Because methimazole only stops new hormones from being made, you're not going to feel better instantly. Your body first has to burn through all the extra hormones that were already there. That's why it can take days or even a few weeks before you really start to notice a difference. So patience is absolutely key here. Okay, so we know how it works, but when do doctors actually decide to use it? Let's look at the main reasons someone might get a prescription for methimazole. By far, the most common reason is for something called Graves' disease. This is an autoimmune issue where your own body's immune system accidentally tells the thyroid to go into overdrive. It's also used to get hormone levels under control before someone has thyroid surgery or a treatment with radioactive iodine, which makes those procedures a whole lot safer. You'll also see it used for a condition called toxic multinodular goiter and in very rare, life-threatening emergencies known as a thyroid storm. And here's the really hopeful part for people with Graves' disease. After a typical course of treatment, usually about 12 to 18 months, there's a real chance of achieving remission. That means the thyroid calms down and you might not need the medication anymore. For some people, that remission can last for years or even be permanent. It's a pretty incredible outcome. All right, now for a really important topic. With any powerful medication, we have to talk about the risks. The goal here is not to scare you, it's to prepare you. It's all about balancing the amazing benefits of the drug with your responsibility to be aware of what to look out for. So let's put the biggest risk into perspective right away. The overwhelming majority of people, we're talking over 99%, do just fine on methimazole. But there is a very small risk, less than 0.5% of a serious side effect called a granulocytosis. It's rare, but it's the one we really need to know about. I think it helps to put side effects into two buckets. On the left, you have the more common but usually minor stuff. Things like a skin rash, maybe some joint pain. Annoying but not dangerous. On the right, though, are the rare but serious ones. Agranulocytosis, which is that big drop in your infection-fighting white blood cells, and hepatotoxicity, which just means liver injury, are the two big ones to have on your radar. Okay, everybody lean in for this part. If you remember nothing else from this section, please remember this. A sudden fever or a new sore throat could be the very first sign that your white blood cell count is dropping. Do not wait. The rule is simple. Stop taking the medicine and call your doctor right away. This is your #1 safety rule. Now, what about pregnancy? This is handled very carefully. In the first trimester, doctors usually prefer a different drug called PTU. That's because methimazole has been linked to a very rare risk of certain birth defects. But then things change. For the second and third trimesters, it's common to switch back to methimazole because the other drug, PTU, has a slightly higher risk of causing liver problems for the mom. It's a careful balancing act.
And that leads us perfectly into our final and maybe most important section, your role in all of this. Because taking this medication isn't a passive thing. It's a true partnership between you and your doctor.
While you're on methimazole, getting regular blood tests is non-negotiable, and each test has a specific job. The thyroid function tests make sure your dose isn't too high or too low. The complete blood count, or CBC, is what keeps an eye on those white blood cells we talked about, and the liver function tests, or LFTs, just make sure your liver is happy and healthy. At the end of the day, success really comes down to this balance. You have methimazole on one side, doing its powerful work inside your body, and on the other side, you have your active participation, taking your medicine correctly, never skipping your blood tests, and speaking up the moment you notice something isn't right. So we'll leave you with this question to think about. Being a partner in your own healthcare means being informed and engaged. So now that you know all this, what's the first question you're going to ask your doctor at your next visit? Because having that conversation is the most powerful next step you can take.